What is sports pharmacology?
So, sports pharmacology is really the intersection of sports medicine, pharmacology, and then also performance. And so, we're really looking at how medications and supplements interact with the unique physiology of athletes, taking into account their training load, recovery, competition schedules, competing across time zones, and then those strict anti doping policies. And if I could illustrate an example of how a sports pharmacist or how someone would define sports pharmacology is we look at how drugs are essentially affecting performance and recovery. So if we take an athlete that has type 1 diabetes who lives on the East Coast and is traveling to a time zone in the mountains like Colorado, where they're at higher altitude, we would essentially work with their endocrinologist to fine tune some of their insulin medications, make sure they're on a rapid acting medication right before any of their training or competition. You take, for example, athletes that may have asthma or suffer from exercise induced bronchospasm, making sure that they're taking their inhaler 15 to 30 minutes prior to their performance or training. So that way it's not impacting their training or performance any. Then you have certain medications called SSRIs, selective serotonin reuptake inhibitors, that can be used to treat depression or anxiety, looking at their side effect profile and how that may impact performance